Good morning. My name is Nora Vargas, and I'm the Vice President of Community and Government Relations for Planned Parenthood of the Pacific Southwest. And I think many of you may or may not know, but Planned Parenthood of the Pacific Southwest is one of the largest reproductive healthcare providers in the San Diego region. We serve San Diego, Imperial County, and Riverside County. We see about 300,000 patients a year, and we provide education to over 45,000 individuals and adolescents in the three counties. We are particularly special because about 25 years ago, our organization understood the importance of the region that we live in and the work that we do and the reality that healthcare really has no borders. And so in 1988, very visionary board members decided to work with MexFam, which is a reproductive healthcare organization in Mexico City, that really focused on this issue of reproductive health. As many of you may or may not know, in the 70s and early 80s, there was a lot of work in Mexico around population control and really reduction of teen sexuality education. So we created this partnership, and a lot of the work was really focused around programs. So it was focused around the Promotora program. It was focused around creating a service provider on the Baja California side that actually could assist youth and women to make sure that they were provided reproductive health. In the last 5 years, most of our work really has been focused on identifying critical reproductive health care issues and really thinking about what does it mean for the region, really taking out the Promotora work, really looking at our partnership with ProSalud and organizations in Mexicali that are doing work to see how can we better influence policy and legislation in the region when it comes to adolescent health. One of the main reasons why we continue to have these conversations and we really value these programs and the work that we're doing is that in California, even though the teen pregnancy rate continues to get lower across the nation, in the Latino community, we continue to see young girls still with higher teen pregnancy rates than anyone else. And on the Baja California side, we know that over 49% of sexually active teens really don't use any type of birth control methods during their first sexual experience. There is a lot to be said about this number because the reality is that a lot of the young people who are having first encounters really are forced. They're not necessarily by personal choice. Another issue I think that's important to highlight here is that in Baja California, it's the fourth cause of death among young women in high-risk pregnancies, and unsafe abortions are the fifth cause. This is important to notice because, in the 2008 Mexico declaration that I think some of you may have heard of already about, with the Mexico City ministerial declaration, there was a focus on trying to reduce teen pregnancies, really provide the education, and trying to make sure that we provided access. And it's not happening. We're not where we need to be. So the key factors, and I'm going to speak really fast because I have 2 minutes. Key factors that are impacting this work is really the access to sexuality education, access to reproductive health care services, and religious influences. On the American side, and all of you know that the impact that it has, socioeconomic impact on poverty in our communities, continues to grow. The cultural values and stigmas around single moms and marriage, and really the increased binational adolescent sex trade. What I really want to emphasize here is that there's a lot of opportunities for collaboration. I think that one of the big issues that we face is that there's a great need for institutional change, because what happens on both sides of the border is that you have the politics of sexual education is incredibly dynamic. On the American side, on the California side, you have progressive 2/3 majority, and yet we don't have a mandate on comprehensive sex ed in California. And on the Mexican side, even though young people also are getting some education around anatomy and physiology, there really isn't real conversations about what comprehensive sex ed is and how that changes. And we know that scientifically, comprehensive sex ed actually when you give young people the education that they need, they make the better choices. And so for the last 5 years, we've had this binational dialogue where we come together. We've actually had some of the folks here have been presenters, and we've created a Binational Advisory Council to really start thinking about how do we do this as a region. So we launched a Binational Teen Pregnancy Prevention Initiative in 2013. We are looking at really focusing on policies and initiatives. It was a different political administration on the Mexican side in Baja California at the time. We have a new mayor, we have a new governor, and so we're doing that work again. And so it's very difficult to do this work when you have a short amount of time to try to really identify policies, change them institutional, and try to move forward. So, oh my God, I'm speaking really fast. So we're doing really a lot of work. It's a lot of work that we are doing, but it's, and I'm looking forward to, having additional conversation with you. But really, there's this whole conversation that we have to have about the politics of sex education in the binational region and what that means to our communities, because really that's where a lot of the resources and the funding comes from to be able to make the change for our youth to also be advocates. So there you go.